Feeling dizzy means different things to different people, but it usually relates to one of three different sensations. Vertigo, which is when the room feels like it's spinning around. Light-headedness, which is when you feel faint, that feeling just before you pass out. Or loss of balance, which is when you're unsteady on your feet. It's important to narrow down your dizziness into one of these types or sensations. If we can do that, we're already well on our way to figuring out what's going on. Let's talk more about each of these dizziness types and what causes them. Vertigo. This is when you feel like the room or the world is spinning, swaying, tilting, or floating around you. Can you remember spinning around and around as a kid and then stopping and feeling the room go topsy-turvy? That's a bit like vertigo, and it often lasts seconds to minutes, but it can go on for hours and be incredibly discombobulating. Some people commonly have nausea and sickness too when they have vertigo. Vertigo is often due to an inner ear problem, and this can usually be caused by things like an inner ear infection. The same bugs that cause throat and chest infections can affect the inner ear too, causing inflammation around the nerves that regulate balance and hearing. Something called benign paroxysmal positional vertigo, or BPPV. The name says it all. It's benign, so it's not serious or life-threatening. It's paroxysmal, comes and goes, and it lasts seconds, and it's positional, caused by certain positions of the head or body, like bending or turning your head quickly, and it causes vertigo, BPPV. It happens when calcium crystals in the inner ear move out of place. Meniere's disease is another common cause, and this is when you have too much fluid in the inner ear, and it usually affects people between the 40 to 60 year age range. It's often associated with hearing loss, ringing in the ears, and sickness, with the vertigo attacks lasting from anything from about half an hour to a whole day. Migraine is another cause. People who experience migraines may have episodes of vertigo even when they're not having a headache. Episodes in this circumstance usually last minutes to hours, and it can often be associated with things like light and noise sensitivity. The second main type of dizziness is light-headedness. Feeling faint or light-headed is a really common cause of dizziness too. This is almost always due to a temporary lack of blood supply to our brain. Most people have experienced this sensation, especially if you get up quickly when you're unwell or you're really hungry and thirsty. The main reasons for feeling light-headed are due to the same causes of a common faint, or the causes of orthostatic hypertension, or the causes of certain heart problems. So when it comes to a common faint, we're thinking things like being dehydrated, too hot, extremely emotional or upset, or after strenuous exercise. The causes of orthostatic hypertension, which is when you feel lightheaded when you stand up, is often due to certain medications which lower blood pressure, or any cause of dehydration, and some neurological diseases that affect blood pressure control. Heart problems can also cause you to feel lightheaded, especially those that affect the ability of your body to supply a regular, uninterrupted supply of blood to the brain, such as unusual heart rhythms. For more information about fainting, check out my earlier video on feeling faint. This is less common and happens when you feel unsteady on your feet, like you may fall over. Balance is coordinated by our brain, which receives signals from your eyes telling us what position we're in, and nerve messages from the skin, the muscles, and the joint. This tells the brain where your body is in space, and your inner ears. They sense where your head is based on the movement of fluid in the labyrinth, which is a part of the inner ear that helps control balance and posture. To be free from balance disturbance, all of these should be in good working order. When any parts of this system goes wrong, balance can be disrupted and you can feel dizzy. This includes things like ear problems, for example an inner ear injury, or nerve disorders affecting signaling of those balance messages, or even brain disorders such as stroke or tumor if that part of the brain that coordinates these messages is compromised. Being frail or ill also results in a less accurate functioning of these balancing modalities, and alcohol and recreational drugs are also common causes. If you're feeling dizzy, it's important to know why. If you have a prolonged episode of dizziness or recurring episodes and it's unclear what's causing them, then you should see your healthcare professional. There are loads of potential causes of dizziness, and we don't always find out what's going on. Actually, for about 1 in 5 people, we don't know exactly what the cause is. One thing that you can do to help is to do a dizziness diary, even if it's for a day or two, including things like how many times you feel dizzy in a day, or how long the dizziness episodes last for. What were you doing when you started to feel dizzy, and how bad was it, and did you fall? Any other symptoms too, like nausea, headache, ringing, or blurred vision. The good news though is that even if we don't pin down the cause, the symptoms often settle over time. Apart from a prolonged episode of dizziness, you should also see your GP if you're worried about your symptoms of dizziness and they persist, or you have ear symptoms like difficulty hearing or ringing, which could be Meniere's disease, or you have eye symptoms like double vision or blurred vision that may indicate things like a stroke or multiple sclerosis, or your arm or your face or your legs feel numb, or you have a headache that's worse when you're lying down or worse when coughing, or if you notice an irregular pulse or chest pain. If you have symptoms of dizziness, the first challenge is to unpick what you mean by feeling dizzy. We want to know which one of the 3 sensations associated with dizziness that you're talking about. Once we're clear on this, we're interested in a broader history, including things like, do you have any other symptoms? Did it start out of the blue or after an illness? Is it one episode, or have you had multiple episodes? And how long do they last for? And does it happen when you move your head, etc., etc.? If you have a consult over the phone, we may feel confident enough to narrow down the likely cause and treat for a week or so and see how things go, but often we may ask you to come into clinic to check your vitals like your temperature, your heart rate and rhythm, blood pressure, and would often examine your ears, your eyes, and other parts of your nervous system like balance, coordination, and strength. We often ask you to move your head into different positions to see if it triggers the symptoms. Rarely, we may need to do more testing, such as blood tests, a hearing test, head or heart scans too. The treatment depends on the cause here. I'm really conscious that I've discussed loads of different causes. In practice, the vast majority of vertigo is due to an inner ear infection and BPPV, and most lightheadedness is caused by the causes of a common faint like dehydration and fever. Loss of balance is much rarer, but we often see this in frailty and stroke. For an inner ear infection, as they're viral, they don't have any specific treatments. It tends to go by itself over weeks, while for BPPV, which is triggered by head movements, a series of tilting head maneuvers helps to get the inner ear working normally again. This is called the Epley maneuver. Do see below for more information on this. Tablets can often help with vertigo like dizziness. Most of these tablets you'll have to get via your doctor, like beta-histine and cyclazine, but some you can get over the counter like cinnarizine. They don't cure the cause, but they often help with the length, the frequency, and the severity of the dizziness attacks until it fully goes away. There are often specific treatments for other causes too, like stopping incriminating medications that cause dizziness, medications for heart irregularities, and managing mood or situational related fainting. If you do have an attack of dizziness, do lie down until the dizziness passes, then get up slowly. If you're having a severe flare-up of vertigo, close your eyes, move slowly and carefully, and get plenty of rest. Drink plenty of fluid, especially water, and avoid things like coffee, cigarettes, alcohol, and drugs. If you're having an attack, don't bend down suddenly or get up suddenly after sitting or lying down, or do anything that could be dangerous while you're dizzy, like driving. Don't lie totally flat too if you find things are spinning around. Dizziness is a subjective symptom. It means different things to different people. Dizziness can feel like the room spinning, or lightheadedness, or like you're losing your balance. There are different causes depending on the type of dizziness you experience, with inner ear infections being the commonest culprit. Symptoms often settle by themselves, but it's worth getting checked out if your symptoms persist, or they're unmanageable, or you're just not sure what's going on. Many thanks for watching. Till next time, stay healthy.